Peace and welcome to For the Culture right here on your source for cool jazz and more, WEAA 88.9 FM and WEAA.org. Absolutely the voice of the community. I'm your host, Farajii Muhammad. Thank you so much for checking in and riding with me this evening. Folks, we have a great show lined up for you this evening. We're going to first talk a little bit about the vaccination hesitation issue, an issue that is very, very prevalent especially within Black and Brown communities. And we're going to be joined by officials from the Maryland Health Department, Dr. Kathleen Page, who serves as an infectious disease specialist at Johns Hopkins University School of Medicine, along with Dr. Clifford Mitchell, who is the director of the Environmental Health Bureau in the Prevention and Health Promotion Administration for the Maryland Department of Health. Tonight, we're going to talk about these things. And of course, we want to open up the phone lines to give you an opportunity to join us in the discussion at 410-319-8888. Also, we are broadcasting and live streaming on our website at weaa.org. So you can also check us out there and download the app if you haven't had the opportunity to do so, and be a part of the conversation as we talk about the issue around hesitancy surrounding COVID-19 vaccination. At this point, let's jump right into the conversation. I'm so happy to have our guest to talk to us a little bit about this issue and what we can expect from COVID-19 moving forward, as there have been big promises coming from the White House. There has been a number of rollouts around the country for the vaccination. There have been some reopenings. There has still been some closings, and people are still trying to figure out what's the best course to take in dealing with this COVID-19 pandemic. So let's welcome to the airways to WEAA, Dr. Kathleen Page and Dr. Clifford Mitchell. Dr. Page, Dr. Mitchell, thank you so much for joining us this evening.
Nice to see you, Farajii.
Thank you.
Thank you so much for having us, and thank you for the listeners.
Absolutely. Thank you. Thank you for being a part of the conversation. First and foremost, Dr. Page, I'd like to start with you, ma'am, and then get your take on this, Dr. Mitchell. This issue of COVID, let's start there. We are a year in at this point. The CDC director, Dr. Walensky, made the warning, or gave the warning, and it was like the shot that went around the world, impending doom. She's afraid and she's concerned that there might be a fourth wave of COVID-19 as we get into the summer months. From your vantage point, Dr. Page, is that the case? Is the data showing that? Is the science showing that? And are people's behavior really consistent with the reality of dealing with this pandemic?
Yeah, I mean, I have to say that it is worrisome. We were seeing the numbers really come down, and as vaccination was rolling out, and I think a lot of us were really hopeful that this would be the last wave that we had last time. But truly, in the last 2 weeks, we just are seeing the numbers coming up, the state's numbers in the hospital. We just have a sense that more people are coming in with COVID and with severe COVID. And I think, I just echo what Dr. Walensky and everyone's been saying. This is really the last mile. Everyone's exhausted. It's a marathon. It's been a true marathon. But we can't give up. It's like giving up on the marathon at the last mile. We really can't give up now. It's critical that, as vaccines get rolled out, and I think we're gonna see more and more supply coming up soon and more accessibility in the next few weeks. Just to remember that even as this is happening, we still need to use masks. We still need to be prudent. We still cannot have huge gatherings. And if we do that, I think we can all together get to really where we need to be, which is the finish line, hopefully by the summer or towards that. But if we don't, and we let go of everything now, and with Easter and other holidays coming, we just let go, I do worry that we're just getting ready for another surge, which is honestly what was seen in Europe as well. And we are always lagging a little bit behind. Mm-hmm. So we're seeing that in Europe now. I hope we don't see it here.
And when we say the surge, will the surge look the same? because she said this is like the fourth iteration of this wave. Can we or should we expect that it will be possibly different because of the summer months that are ahead, because of people's behavior, because some folks have been vaccinated and others have not? Will the surge look the same? Can we still expect a huge numbers? I mean, we're getting a number of cases, but can we expect larger or significant number of cases?
Well, I think there's a couple of things. It'll depend on a few things. It is encouraging, and I just heard data nationally that over 70% of people over 65 have been vaccinated, and that's huge, because we know that over the people over 65 are the highest risk of getting really sick, dying, being in the ICU. So we have enough vaccination for that group. That is reassuring. However, that does not mean that people under 65 can't get really sick and can't get into the ICU or die. And we certainly have seen that. And it's people with comorbidities, but it's also other people. So that, it is, I think it will look different, because hopefully the older group, if they're vaccinated, won't be as affected. And certainly everyone who's been vaccinated shouldn't have, based on the data that we have, these vaccines are 100% effective against severe COVID. So we shouldn't be seeing that. But the one sort of, what is it called, loose cannon on this mix is the variants. So we know the vaccines work really, really well and against the viruses that we've had. But if we see a lot of transmission, that gives the virus a chance to change and mutate. And if we had a new variant, that the vaccine doesn't work as well, then we could start seeing other things. So long answer, I think you're right. It's going to look different. Hopefully it'll look different in a good way, like older people more protected, all those who are vaccinated protected. I think that should be the case. But, again, to re-emphasize that it's not just older people. We certainly have seen, and it's particularly in Black and Brown communities, young people with comorbidities getting quite sick. So we really still have to all keep our guards up, even if you've been vaccinated. And in fact, those who have been vaccinated, who have been lucky to be vaccinated, because I feel like given the shortages in supplies, the ones who have been lucky to be vaccinated owe it to everyone else, a responsibility to our communities to continue doing the right thing so that we don't keep on transmitting the virus.
Dr. Mitchell, I want to bring you into this conversation because as I'm listening to Dr. Page, I'm just wondering, there's still so many questions that people have. And based upon the data coming from coronavirus.maryland.gov, which is one of the big trackers that we've been using here at the station, I mean, we've seen a slight tick in the positivity rate. Right now, it stands at 5.24%.
Yep.
Just literally 2 days ago, we were at 4.9%.
Yes.
Prior to that last week, on Friday, it was like 4.6. So now we're getting over the quote unquote, the metric, the real big metric that people say that now we should kind of be concerned. Should we be concerned, even though at the same time, there's been 903 new cases over these past 24 hours? Should there still be a concern coming from the state of Maryland? Should we see more of this hands-on, strategy on trying to deal with this issue?
Farajii, thank you. And again, thanks to you and WEAA for doing this public service. And I just want to agree, first of all, with Dr. Page, absolutely, completely, 100%. We do know that we've vaccinated a significant portion of the older population of Maryland, and that has been really, really helpful. It's also true we've vaccinated a significant number of healthcare workers, emergency workers, and the vaccine has been effective in all of those cases. But I do want to emphasize, when we're talking about overall numbers, it's important to understand, and you've already talked about this, some of our most heavily hit communities have been people where there are questions about the vaccine and about whether or not that they're with those communities, whether or not they have access to vaccine, whether or not they are able to and are interested in getting the vaccine. The overall numbers are ticking up, but it's also important to recognize that those numbers are even more significant in the Black, Brown communities who are, for many reasons, at increased risk, and where there is a lot of question about whether or not to think about getting the vaccine. I think this show and many others are really important. The governor's clearly made an emphasis and emphasized the importance of equity in terms of both resources and vaccine and getting into those communities and answering questions. So I think the answer to your question is, will it look different? Well, unfortunately, one of the ways it won't look different, it may look different in terms of the age of the people who are getting infected. It does not necessarily look so different in terms of the communities that are hard hit. And so I really want to just say again, it's not just the overall numbers that we're concerned about. It's especially those hard hit communities.
And Dr. Mitchell, what about the consideration for alternatives? Has there been some really extensive conversations either on a state level, or even on a national level, that since you do have and I'm just saying significant number of folks within the Black and Latino communities that are still hesitant about taking the vaccine, has there been some conversation about other alternatives besides getting the shot? I know that there's been an emphasis on that.
Well, I have, yeah.
About that?
So let me just say, at this point, there are really the way you can protect yourself from COVID is if you're not vaccinated, keep on doing the same things that we've been recommending over and over again. The using of a face covering, staying away from large social gatherings. But at this point, the thing that we know is, the vaccine is incredibly effective, and that's in all groups, all populations. Number two, even medical treatment for the vaccine, for the virus, such as the monoclonal antibodies, which have been very successful in reducing the risk of severe disease in people who do get infected, don't protect you from getting infected. So the fact that you get mild disease and stay out of the hospital, it's important to understand that we still are hearing more and more about the long-term effects of COVID infection, including some of the neurologic effects. It's not clear that monoclonal antibodies protect as effectively against those long-term effects. So I really want to emphasize to everybody at this point, protection against COVID really means a vaccine, and whether it's the Johnson & Johnson single shot or the Moderna and the Pfizer 2 shots, each one of them is better than not being vaccinated at this point and reduces your risk of being hospitalized, reduces your risk of death, and protects people you love and people in your community as well.
How does herd immunity play into this?
Well, we've heard a lot about herd immunity. And unfortunately, it takes us a while to get to that point. If you think about being in a room with a large number of people, if only one person is infected, your risk of getting infected is pretty low. And that's sort of the theory of herd immunity. Whereas if there are a whole bunch of people who are not immune who are in that room, many of them could get infected. So herd immunity only happens when you've really immunized a significant chunk of the population. And people estimate for COVID, that might be 70, 80, or 90% of the population having either natural immunity because they've been infected or vaccinated.
Folks, if you're just tuning into For the Culture here on WEAA 88.9 FM and WEAA.org, tonight we are talking about hesitancy surrounding the COVID-19 vaccination. I'm joined by Dr. Kathleen Page, who is an infectious disease specialist for Johns Hopkins University School of Medicine, along with Dr. Clifford Mitchell, who serves as the director of the Environmental Health Bureau and the Prevention and Health Promotion Administration for the Maryland Department of Health. I want to go back to you, Dr. Page, because now that we're in this kind of uncertain space, what do we know about the vaccination? Many people have been asking me, they're saying, well, what is actually in the vaccination? So I'm going to pose that question to you and to Dr. Mitchell. What is in the vaccination?
Well, so there's 3 vaccines right now, and basically what they do, like all vaccines, really, this is not new. Vaccines basically they tell our bodies make a defense against something that is foreign for you. And in this case, what's foreign is the spike protein, which is the spike protein is the key that the virus uses to infect us. And so if you can protect against that spike, that key, the virus cannot really infect us. So none of the vaccines, one thing that's important for everyone to know, none of the vaccines have the whole virus. They don't have the whole virus. What they have are instructions to our bodies to make that spike protein, that key. And so when you get the vaccine, you get an instruction. In the case of, for example, the Pfizer and the Moderna vaccine, that instruction comes in what's called a messenger RNA. It's almost like a Snapchat message. It's a message that tells the body, make that spike protein. The body makes a little bit of your cells, your cell machinery makes that spike protein. Your immune system says, what's this? I've never seen it before. Develops defenses, antibodies. And that basically means that if you get exposed, like if after you get the vaccine, after you 2 months later, someone coughs on you with the virus, your body is going to be like, I've seen this before. This spike protein, not the whole virus, but I've seen that key, and I'm going to block that key so that virus cannot infect you. So that's what the vaccines have. So they have instructions in different forms, but it's mRNA. The Johnson & Johnson has like a viral vector, which is not the coronavirus or anything like that. It's used in many other vaccines to tell our body, make that spike protein, make that key so that you can recognize it the next time you see it and block it, and the virus cannot infect you.
And
Does
what
that make sense?
Yeah, I'm following you. I'm definitely following you. But what do you make of the stories that we've been hearing that people who get the vaccination and then a couple of weeks later they either contract COVID-19, or some of them, they get really sick, or unfortunately they become a fatality as a result of COVID-19?
Yeah. So there's been a lot of sort of messages on social media and the news, even like, people will talk about this. And I think I'm going to break it down on a couple different scenarios. So one scenario is a person who got the vaccine and then suddenly finds out they have COVID, right? Now, that usually, and every case that I have seen has been within like a week of getting vaccinated. What that means is that, in fact, one of my patients today called me. She had gotten vaccinated on Sunday, and today she got a COVID test and it was positive. Talking to her, she had a fever on Thursday. So most likely she had COVID. She didn't really recognize it and then got vaccinated. And in all those cases where you hear someone got vaccinated and within a week they had COVID, what that means is that they were likely incubating the virus. And so the vaccine doesn't work immediately to protect you. The reason is that, when you get that message, make that spike protein and defend, it takes about really 2 weeks for the vaccine to really get those antibodies, those defenses. So those have been those cases. There really haven't been well-documented cases of severe COVID or any type of COVID happening way out. Once you have your defenses, once those 2 weeks after vaccination, getting COVID really is not something that we're seeing at all. So that's
but there is that 2 week window.
Yes.
Where you could possibly get COVID.
Yes.
Now, that during that 2 week period, is your immune system a little weaker than it would have been because it's still trying to process the vaccine?
Such a good question. And I hear that all the time, and it totally makes sense, right? It makes sense to think, well, my body is trying to make an antibody for one thing. It's like all distracted doing that. I'm going to get some other infection. But that's not how our immune system thankfully works, because if it worked that way, we get exposed to different bacteria, viruses all the time. And so if it only could handle one task at a time, we would all be dead, basically. The reality is that the immune system multitasks better than any of us can do. And so it'll respond to whatever comes our way. And so the fact that we're building immunity because we got a vaccine does not mean that we can't deal with whatever else is happening around us, whether it's the cold, the coronavirus, or something else. So that's not what's happening. Now, I do want to emphasize one thing. I said it takes about 2 weeks. Remember, the vaccines, 2 of them have 2 doses. So to really be fully immune, you really have to, you get the first dose, then you get the second dose, and then 2 weeks after is when you truly are fully immune to the virus. It doesn't mean that you haven't built any immunity along the way, but it's not fully immune until you really have completed everything.
But there could be some time between that first dose and the second dose, because I'm hearing some people might get a first dose for 1 week, and then 2 or 3 weeks later, depending on when the next test, they might get the second dose. So it could really depends on when you get in the vaccination.
Yes, and I'm gonna throw my teenage son under the bus, but he's not hearing, I don't think.
Okay.
But I'm gonna give an example of why this probably is happening behaviorally. So he's 19, he has not gotten vaccinated because he's not eligible, but he told me, he's like, I cannot wait to get vaccinated because that the next day I'm going to a huge party. And I was like, well, that's not a good idea, because the next day after you get vaccinated, you're still not immune. So if you go to a big party right after you get vaccinated, you're likely going to get COVID and so I think that may be what's happening, that people are getting vaccinated. And of course, we're also tired and sick and tired of this vaccine, of this COVID, that as soon as people get vaccinated, they're like, yay, now I can go and party.
Right.
But really, they can't. Not yet.
Right.
They really have to wait.
And Dr. Mitchell, I want to bring you back before we take our first pause, but I want to get your take on that, because there's so many mixed messages. Dr. Page just kind of spoke on that. There's so many mixed messages. There are a couple of things, really. You have the number of the messaging that's coming from this, because I remember at the beginning of this process, when the vaccination were made at warp speed, it was, the narrative around the vaccination was that it was a supplement. It was not the end all be all. It was not the cure. It was only a part of doing some other things. It seems like the narrative is shifting a little bit to say, hey, if you want to get your life back and get back into a place of normalcy, then this is the only way you can go. How do you reconcile those two messages, especially with the community and with communities that are already uncertain and distrustful of the medical industry?
No, it's a really good question. It's a really, really good question. And I think the way we're approaching it is really to engage with people who are in the community and have them talk to their friends and neighbors. It is challenging when you're talking about a really complicated process where we've been just giving people, and people have been, I have to say, people have been astounding. I mean, it's amazing what the whole country and the state have done in terms of people really rallying around this, but it is exhausting and it is really tiring. And I can't wait till I don't have to wear a face mask all the time. Mm-hmm. But the truth is, we are going there by steps. And the first step, obviously, was there was the governor's restrictions and the face masking. And that was when we had no vaccine, no therapeutics, and we couldn't even diagnose the problem because we didn't even have test supplies. We're now way far ahead of that because we can test. We actually understand the virus amazingly well compared to where we were a year ago. And we have a vaccine, and we actually have medicines that can treat early infection. But with all of that, the one thing we don't have is this is still a virus that human beings haven't seen before. And because they haven't seen it before, there is no population immunity to this organism. The reason we do with the flu, I mean, remember, the flu comes around and it changes a little bit each year, and we manufacture a vaccine to it to accommodate to that every year. This, in many ways, could potentially become something like the flu, where we have to continuously, we'll see it go around in a wave, and we have to tweak it and our vaccine a little to accommodate to it. We don't know if that's what's going to happen yet. But in the meantime, more people have not seen the vaccine, have not seen the virus than have seen the virus. More people have still not been infected than have been infected. So there's still a huge group of people out there in the community who are at risk and significantly at risk. So for us, the advice is going to continue to be wear the mask, socially distance. Even after you get the vaccine, you are protecting other people by doing those things. You are protecting your family. You're protecting your friends. You're protecting your community. And until a whole bunch of us are vaccinated, that's really going to continue to be the message.
Dr. Kathleen Page is the infectious disease specialist for Johns Hopkins University for the School of Medicine. Dr. Clifford Mitchell serves as the director of the Environmental Health Bureau and the Prevention and Health Promotion Administration for the Maryland Department of Health. Dr. Page and Dr. Mitchell, we appreciate your time and thank you so much for giving us some more insight about the vaccination hesitation process and more importantly about COVID-19.
Thanks, Farajii. And just if people need more information, then you can always call 855-MD-GO-VAX.
855-MD-GO-VAX.
That's correct.
Thank you so much, Dr. Mitchell. And thank you so much for your time this evening, Dr. Page.
Thank you. Thank you so much. I think I just want to recognize that this is very quick and new, and it's understandable and natural that people have questions. And that's what we're here for, to really answer questions and to help people make the best decision they can for themselves.
Absolutely. That's what we're here for as well. We have to do the same thing here, making sure that people have all the information to make the best decision for themselves and certainly for their families. Thank you so much, doctors. We truly appreciate your time.